Christy Marcella, a nurse practitioner at a women's health office, and she is going to now talk to us about concerns when there's problems with a women's health.
Yeah, so I do see a lot of yeast infections. Patients may call the office complaining of itching and burning, maybe a thick white discharge. Typically that indicates a yeast infection. Your provider most likely will bring you into the office, will do an exam, look at the vaginal area, maybe take a little swab or collection of the discharge to confirm if it's bacterial and or yeast. With a yeast infection in the summertime, it's not uncommon to get that. Yeast likes to grow in a warm, moist environment. The vaginal area is a good indicator place for that to occur. Also, yeast likes sugary sweets, and in the summer we're drinking more sugary drinks, eating more candy, and also in a wet bathing suit. So it's a perfect scenario for a yeast infection. Treatment for a yeast infection, there are some over-the-counter remedies that is fine to try, but no, it may not be the right amount of strength or the right type of yeast medication. So if you're not getting any relief after trying over-the-counter, make sure you do contact your healthcare provider. They will either call in a pill for you, oral pill, and or they may call in a vaginal cream. In the other side of it, you can also get a bacterial infection. That is also not uncommon in the summertime. You can get this any time of the year though, but in the summertime, once again, with being in our bathing suits, with being more sweaty, bacteria likes that type of environment. With bacterial infections, you can also get discharge with itching and irritation, but the number one indicator of the difference that we see as a provider or with patients' complaints with bacteria, you're going to get a strong odor, possibly a fishy odor. That would be more indication of a bacterial infection. That is treated differently. It's treated with an antibiotic, depending on the way you take the antibiotic. If it's oral medication and or vaginal applicator, just make sure you follow the directions on how long you need to treat that infection. I would also recommend that even though you're feeling better, that you complete the whole regime of the prescription. It is not sexually transmitted infection. It's not considered an STD if you have a yeast and or bacterial infection, so partners don't need to be treated.
Okay. Any other warning symptoms that you might see someone come in for that they need to be concerned about?
The other one I would think of also would be frequency or burning with urination. If you're having frequency, you're getting up in the middle of the night to go to the bathroom, it may burn, you may have some discomfort, you may notice a different odor in their urine. You need to call your provider. They'll probably get a urine specimen. With that, they'll give you a little towelette. They'll ask you to wipe from front to back with the towelette. You're going to go to the restroom a little bit in the toilet, and then you're going to have a plastic cup that you'll collect the rest of the urine. They will either do a quick test in the office with what we call a dipstick. It's a stick that indicates if you have white blood cells, which would indicate an infection, leukocytes, which would also indicate an infection, possibly blood, possibly sugars in the urine, and they also may send that specimen to the lab that they will do further testing on. If you have a urinary tract infection, I encourage that you drink lots of water, stay away from caffeinated drinks, stay away from carbonated drinks, so your Cokes and Sprites, because that can irritate the bladder. And then also they're going to put you on an antibiotic typically if you have a urinary tract infection, and take all that medication even though you're feeling better.
Okay. There's lots of just general health problems that affect women more than men. How can we prevent, or vitamins to take, or screenings? What are some of these women's health issues?
So for women's health, there are lots of women's health vitamins out there. I do recommend vitamins. There's not one particular brand that I like, but for women's health, we need to focus on our calcium. We need approximately about 1,000 milligrams of calcium a day.
And that's for preventing osteoporosis?
Yeah, so that would help with the bone strength. There's also vitamin D that would be in with that calcium supplement. Vitamin D is also absorbed through sunshine. Vitamin D helps to transport that calcium to the bone, and that will also help prevent against osteoporosis or osteopenia, which is thinning of the bone. So this is a cross-section of a normal bone. That's what your bone would look like on the inside. See how strong it is? This is a display of somebody who has osteoporosis. which is really thin. So you can imagine if I took this off and threw it to the ground, it would probably break. And that's what happens when you have osteoporosis and or even thinning of the bone, osteopenia. You're more at risk to break these little tuberculi in here that causes fractures. So we want to work really hard to keep our bones like this, and that is maintained with exercise, at least 30 minutes a day. I would go for at least 3 to 4 times a week with calcium, vitamin D, and a well-balanced diet. I will tell you the big confusion I have is patients think osteoarthritis is the same thing of osteoporosis, and they're two different types of disease states. Osteoarthritis is more arthritis. You have joint aches and pains. It's very, very common in the older population. Osteoporosis is thinning of the bone, and with having osteoporosis, you're going to be more likely to fracture. So if you fracture, have had multiple fractures, and or you fractured for really no traumatic event, you need to make sure you indicate that to your provider. There are screening tests we can do. There's blood tests to look for calcium in your blood. There's blood tests to look for vitamin D level. And then there's also a bone density scan that typically we don't start until the age of 50, but it looks for the strength or the density of your bone.
Do we know why women get that more often than men?
So yes, a lot of times it's going to be hormone related. Estrogen does support the bone, and then also with the calcium, and then genetics. We do tend to follow our family gene with osteoporosis, with the genetics in the family. Also, thin white female are more likely to have osteoporosis than not.
Okay.
Yeah, so the other concern that we have in women is heart disease. It's typically the #1 killer right now in women. It is a silent killer. I think as women are busy, we tend to ignore our symptoms. It's extreme fatigue. It's not necessarily the heavy pain like an elephant sitting on your chest, but it may be extreme fatigue, the exhaust. It may be a little bit, I feel like I'm having indigestion, or oh, maybe I ate something, I just don't feel comfortable. If you have those signs and symptoms, you need to go to the ER or contact your healthcare provider. Typically though, that's not until the age of 50, but depending on your family history, you may need to be a little bit more cautious in looking for some of the signs. Things you can do to prevent heart disease is diet and exercise. Omega-3 fatty acids is the other over-the-counter supplement you can take, or eating green leafy vegetables, salmon, fish have some of the omega-3s in it.
Any advice you could give to young women that may be embarrassed about some of these topics, about how to open up a conversation or address questions that they might have? How do they get questions answered?
Yeah, so in our office here, if you become a patient, I'm always very open with these patients and try to make them feel comfortable. But we also have with our electronic charting, they can also go online if they're not here in the office and ask me questions.
Okay.
Sometimes you feel a little bit more comfortable not speaking to somebody face to face, so you may ask your provider if there's any way they can ask questions on another level. Sometimes just contacting over the phone. You can also write it down on the sheet of paper. When you see your provider, on our sheets of paper says, do you have any concerns? You may write it down there. That way the provider will open up that question to you, and you're not the one that needs to initiate it. You can always speak to your friends, to their parents, and or to older siblings. Just be cautious the information you're getting is accurate, and if you have any questions or concerns, I would go to a healthcare provider and or adult to make sure that those are accurate findings.
Gotcha. Well, thank you so much for all your information and advice and tips. We really appreciate it.
Thank you.
Thank you.